Everyone. Today we're going to go through chapter 5, which is about the cardiovascular system, the heart and blood vessels. There's actually two parts to the cardiovascular system. So we are going to start with this first part. So overview of the cardiovascular system. It's made up of the heart and blood vessels. The heart pumps blood through the blood vessels. It brings nutrients to cells and helps get rid of wastes. The exchange of substances occur through interstitial fluid, that fluid in between the blood vessels and the cells and the lymph. We'll get into all of that. So the cardiovascular system works along with all of the other organ systems. We'll list a bunch of them later. But there are thousands of miles of blood vessels that move the blood and its contents to and from all of our organs. Working with the respiratory system, it drops off carbon dioxide and picks up oxygen at the lungs. Working with the nutrient exchange, working with the digestive system. Nutrients enter our bloodstream at the intestines, transport much needed substances to our body cells. It works with the liver, supporting metabolism, detoxing, all the stuff that shouldn't be there. And of course, the ever-present homeostasis. At the kidneys, the blood is purified, water and salts are retained as our body needs them. Immunity, the lymphatic system and the immune system assist the cardiovascular system by collecting excess interstitial fluid and then returning it back to the blood. When fluid enters the lymphatic vessels, it is called lymph. The immune system cells and their associated antibodies and chemical signals help protect the body from infection. Types of blood vessels. There's three main types of blood vessels that we will talk about: arteries, veins, capillaries. The arteries, I like to highlight the A to remember that arteries carry blood away from our heart. That's just a rule of thumb to remember. Their walls have three layers. So if you cut a cross section and you look down the barrel of an artery, it has an endothelium. Remember, endo means inner. So the thin inner epithelium, a middle layer of smooth muscle and elastic tissue. That part allows arteries to expand and recoil if we need to, more blood flow to an area or less blood flow to an area. And then just an outer layer of connective tissue that binds it all together. Arterioles are just smaller arteries. These arteries start off thick and they get thinner and thinner and smaller as they go towards our organs. The middle layer has mostly smooth muscle that contracts to constrict the vessel and reduce blood flow, which raises our blood pressure. When it's relaxed, the vessel dilates, which increases blood flow and reduces our blood pressure. We have capillaries, or microscopic vessels found between arterioles and venules, which are the tiny veins we'll talk about in a minute. The walls of the capillaries are made only of endothelium. That's it. There's no triple lining. But they form capillary beds, which is that kind of interconnected web in between the arteriole and the venule. And that is where gas, nutrient, and waste exchange occurs. Capillary beds are very, very important to our functioning. They have what's called precapillary sphincters, which control blood flow through the capillary bed. A sphincter is a ring of muscle. When it squeezes, it kind of slows down blood flow, or it squeezes off blood flow, and then when it opens, it relaxes. When closed, the blood flow instead flows through an arteriovenous shunt. And then, like I said, you go from the capillary to the venules, which are small veins that receive blood from the capillaries, and then those get bigger and bigger. The veins carry blood toward the heart, the opposite of the arteries. Venule and vein walls have the same three layers as arteries, but less smooth muscle in the middle layer. And veins that carry blood against gravity actually have valves to keep the blood flowing toward the heart. Walls of the veins are thinner than arteries, so they can expand to hold more blood. At any one time, they will store 70% of our blood. We're always pushing blood back towards our heart. If blood is lost, called a hemorrhage, the nervous system causes the veins to constrict to increase blood volume to keep it where it is. The heart is a double pump. This section is all about the heart. So it's located between the lungs. Most people know where their heart is. It's tilted so that the bottom points towards our left hip. Consists mostly of myocardium, which is made of cardiac muscle tissue. Muscle fibers are branched and connected by the intercalated discs, which contain gap junctions. And those allow cells to contract in unison. Every single one of our heart cells contract at the very same time to keep our heart pumping properly. It's also connected by desmosomes, a type of cell junction that prevents overstretching by holding adjacent cells together. The heart is surrounded by a sac called the pericardium, which secretes pericardial fluid for lubrication and cushion. Our heart just kind of sits in a bag with fluid like that. Internally, so you cut the heart in half and you open it up. There is a septum that will divide the heart into right and left sides, just like if you have a septum piercing, that's the middle of your nose. Your heart also has a septum, that middle part that divides it. It consists of 4 chambers. The upper chambers are called atria or atrium if we're just talking about one. The lower 2 are called ventricles. There are valves in our heart to keep blood pumping the correct way so it doesn't flow backwards. There's 2 types, semilunar valves and atrioventricular or AV valves. The AV valves are reinforced by chordae tendineae. They're kind of strings of connective tissue. The left AV valve is called the bicuspid or mitral valve. The right AV valve between the atria and the ventricles is called the tricuspid valve. The 2 semilunar valves lead to places outside of the heart. There's a pulmonary valve and an aortic valve. Circulation, coronary circulation. The myocardium needs its own blood supply, so our heart is surrounded by its own arteries and veins to supply it with blood, with the oxygen that it needs to function properly and enough veins to get rid of the carbon dioxide that it generates. So the first branches off the aorta are the coronary arteries. Coronary veins will drain it. That empties into the right atrium. Coronary artery disease is a blockage in the coronary arteries that may cause a heart attack, or the fancy name, myocardial infarction. The passage of blood through the heart. We're going to go through this as a series of steps, a couple of different times, actually. But when we talk about blood flow through the heart, we always talk about the 2 big veins that come into the heart, into the right atrium. That our body collects blood from all over. Our veins all flow to these 2 big veins, into the vena cava. You have the inferior vena cava on the bottom and the superior vena cava on the top, but they both go to the right atrium. So they will bring very deoxygenated blood, oxygen poor blood, into the right atrium. The right atrium will contract, sends blood through the tricuspid valve into the right ventricle. The right ventricle will pump blood through the pulmonary valve into the pulmonary trunk, which branches into the right and left pulmonary arteries. And if you haven't guessed yet, the word pulmonary is related to the lungs. If you speak Spanish, what's the Spanish word for lungs? Pulmonada. It's anything pulmonary will lead to your lungs. So picks up oxygen in the lungs. We'll get to the details of that. But now the blood has to come back to the heart. Now it has oxygen. And the blood travels through the pulmonary veins back towards the heart to the left atrium. So there are a few different sets of pulmonary veins. You can see 4 of them there. And all 4 of those veins lead to that same chamber, the left atrium. Blood then flows through the left AV valve or the bicuspid valve into the left ventricle. The left ventricle, when it pumps, when it squeezes, it sends blood through the aortic valve and then through the aorta. The aorta takes the blood with lots of oxygen now to the rest of the body. A few other details. The walls of the left ventricle are thicker than the right ventricle because it must pump blood to the entire body, not just a hop, skip, and a jump over to the lungs. The walls of the atria are thinner than the ventricles because when they pump, the blood just goes down. It doesn't go anywhere too far. And first the atria contract together, and then the ventricles will contract together, and then the heart will relax for a second. There's a demonstration there in the GIF. Atria goes first, then the ventricles, then it rests for just a millisecond. The cardiac cycle. A systole is our heart contraction. A diastole is our heart relaxation. It occurs 70 times per minute on average. And there are 2 audible sounds. We call it lub-dub or lub-dup sometimes. Lub comes from the closure of the AV valves, and then dub comes from the closure of the semilunar valves. A heart murmur is a swishing sound between the lub and the dub from the regurgitation of blood and usually signifies a leaky valve. Inside of our heart, it's called the internal or intrinsic conduction system. Our heart runs on electricity. So something needs to jumpstart that electricity and make sure our heart pumps the correct way every time. The sinoatrial or the SA node in the right atrium will initiate the heartbeat by sending out an electrical signal, which causes the atria to contract. The SA node is also known as the pacemaker because it is the first signal to say, hey, pump, hey, pump. That's what the electricity signals. And a node is just kind of a concentrated bundle of tissues when we talk about nodes. This impulse reaches the AV node, also in the right atrium. The AV node will send a signal down the AV bundle and the Purkinje fibers, and this causes ventricular contraction. It needs a little more electricity through the ventricles because it has to pump blood a lot farther. These impulses travel through gap junctions in the intercalated discs. So there's the SA node, there's the AV node, and then there's the branches and the Purkinje fibers all throughout both of the ventricles. The external or extrinsic control of the heart, the cardiac control center in the brain, increases or decreases the heart rate depending on the body's needs. We also have hormones that will increase or decrease our heart rate. So the external control of the heart is actually controlled by our brain. An electrocardiogram, or an ECG, sometimes called an EKG, is a recording of the electrical changes in the heart muscle during a cardiac cycle. The atria produce an electrical current called the P wave, which is stimulated by the SA node, like we just said. The next wave is called the QRS complex, and that's the wave of electrical current traveling through the ventricles as they contract. And then there's also a small wave at the end called the T wave when the ventricles are relaxed. So you can see in the picture what's happening and how it is measured in that. P wave is the atria, QRS is the ventricles, T wave is the relaxation. Its purpose is to detect abnormalities. There is a very specific time frame that P wave should happen in. There's a very specific time frame when the QRS waves should be happening. There's a very specific time wave for that T wave. If any of our numbers fall outside of those, something is wrong. So ventricular fibrillation is caused by uncoordinated, irregular electrical signals in the ventricles. The heart can't properly pump blood. Tissues become starved of oxygen, and nothing good happens when our tissues are starved of oxygen. Defibrillation is applying a strong electrical current to reset the heart. Hopefully the SA node will start firing normally again. That's the hope every time they apply that electric jump to a person's chest you see in the movies all the time. So you can see on the bottom left is a chart. A normal heart rate is between 60 and 100 BPM, stands for beats per minute. The PR interval, that's the time between the P wave and when the R wave starts, should be between 0.12 and 0.20 seconds. All the rest of them have average numbers too. But at the top, you can see the normal ST segment. That's the QRS. The S ends about right here. And then the T starts about right here. That is what it looks like normally. Sometimes it lasts a little longer. ST elevation. Sometimes a little shorter. ST depression. This is when a doctor will look at it and say, something might be wrong with the electrical system in your heart. Let's do some further tests. Next section is about blood pressure. So first you got to talk about the heart rates. When blood surges into an artery, it causes the waves to stretch and then recoil. It's usually measured in either the radial artery at the wrist or the carotid artery in the neck. A measurement of the heart rate averages about 60 to 80 beats per minute. Blood pressure is the pressure that blood exerts against the blood vessel walls. It is highest in the aorta, right next to the heart, of course, because that's when the left ventricle pumps it the hardest. but it progressively decreases as blood moves through the body's vessels, arteries, arterioles, capillaries, venules, and finally the veins back to the heart. It is the lowest in the superior and inferior vena cava, which enter the right atrium, and it is measured with something called a sphygmomanometer. Sphygmomanometer. It's a big word. And we measure it in the brachial artery of the arm. There's two types of blood pressure that we measure in our average blood pressure numbers. There's the systolic pressure, which is the highest pressure point when blood is ejected from the heart, and then the diastolic pressure, the lowest pressure when the ventricles relax. Its average is 120 over 80 millimeters of mercury. That's a systolic over the diastolic. And in the old days, they actually measured it with mercury, and we've just stuck with that measurement. Hypertension is high blood pressure. Hypotension is low blood pressure. We talked about the meaning of the prefixes hypo and hyper in the last chapter. Average values for adult blood pressure. Normal is below 120, diastolic normal is below 180. Little bit elevated is when the systolic pressure might be elevated a little bit between 120 and 129, but the diastolic is still below 80. And then you have stages of hypertension depending on if it's just the systolic that's high, if it's the diastolic that's high, if it's both of them. And then, of course, there's a crisis once it gets to a certain level. Blood flow through the capillaries. Blood pressure decreases as it flows away from the heart. It is the slowest in the capillaries to increase the exchange of gases, nutrients, and wastes. And it is adjusted by those precapillary sphincters that I was talking about earlier. Blood pressure is low in the veins, so it doesn't contribute much to the movement of blood. Venous return is dependent on 3 additional factors. The skeletal muscle pump. It's actually, our blood flow is actually dependent on how our skeletal muscles contract all the time. A respiratory pump depends on our breathing, and then our valves present in our veins. So this is just an example of the skeletal muscle pump. Contracted skeletal muscle will push blood past the open valves. And then you have the valves there, which close every time the heart beats, so it doesn't flow backwards. 2 cardiovascular pathways. This is where we're going to repeat ourselves a little bit when we talk about the pathway of blood through the heart. So the pulmonary circuit, like I said, what does pulmonary mean? It means lungs. So the pulmonary circuit will pump blood through the lungs, and the systemic circuit will pump blood through the rest of our systems. In the pulmonary circuit, the right atrium pumps deoxygenated blood to the ventricle, pumps it to the pulmonary trunk. The pulmonary trunk splits into right and left pulmonary arteries, which go to the lungs. And then in the lungs, the pulmonary arteries branch to arterioles, which lead to capillaries. And our capillaries in our respiratory system are covering the little alveoli in our lungs. That will come, we'll talk about that when we get to the respiratory system. But I like that picture. There's your airways in yellow. The pulmonary arteries are in blue because they have deoxygenated blood. And then you have in red, those are the pulmonary veins that now have oxygen, where the blood now has oxygen. Capillaries are where the physical process of gas exchange occurs. And we'll talk about this a few times this chapter, and then again when we get to the respiratory system. So at the top, the deoxygenated blood from the heart carries high levels of carbon dioxide. Carbon dioxide diffuses into the alveoli to go back up our lungs so we can expel it out with our breath. And then oxygen diffuses into those red blood cells at the bottom and returns to the heart with high levels of oxygen and low levels of carbon dioxide. So this is happening constantly, every second of every day of your life. The pulmonary capillaries lead to venules, which lead to the pulmonary veins. The 4 pulmonary veins empty into the left atrium. And then the systemic circuit. The left ventricle pumps blood into the aorta, which gives off branches to all the tissues of the body. The arteries branch eventually into arterioles, which lead to capillaries. There are capillary systems in all of our major organs for gas exchange, that oxygen from the blood cells to our organs, and then carbon dioxide from the cells into the bloodstream and then back out. Capillaries lead to venules, which drain into veins, which lead to the superior and inferior vena cava. The system starts over when the vena cava empty into the right atrium. Usually blood flows from the aorta into an artery that supplies an organ. Gas exchange happens in capillaries, then through the veins back to one of the vena cava. However, there are special routes that don't follow this pathway, such as the hepatic portal system. Hepatic, just like pulmonary means related to the lungs, hepatic is something that's always related to the liver. So you have a special hepatic portal vein that brings nutrient-rich blood from the digestive tract to straight to the liver. The liver synthesizes blood proteins from the amino acids in the hepatic portal vein and stores the glucose as glycogen. The liver also removes toxins and pathogens that enter the blood through the digestive system. Blood is drained from the liver into the hepatic veins, then it gets drained back to the inferior vena cava. So we start at the bottom because that's where the intestines are found. Products of digestion are absorbed into the capillaries within the villi of the small intestine. Digested food molecules then travel through the hepatic portal veins to the liver. Liver monitors blood content for toxic materials. And then after that, if it's safe enough, it sends it through the hepatic veins to deliver blood back to the circulatory system and then up the inferior vena cava. We'll talk about a little more about the exchange in the capillaries. Two forces drive fluid into and out of the capillaries. The blood pressure drives fluid out of the capillary, mainly at the arterial end of the capillary bed. This fluid contains everything that blood contains except for cells and plasma proteins. Osmotic pressure draws water into the capillary by osmosis, mostly the venular end. Some tissue fluid enters lymphatic capillaries and becomes lymph, which is eventually returned to the cardiovascular system. So this is a great short video that I'm going to show and hope that it sticks.
You're probably familiar with the circulatory system and the blood that flows through it, as it supplies every tiny corner and capillary of your body with nutrients and oxygen. You can see your blood after you get hurt, but blood isn't the only fluid circulating in your body. There's another plumbing system working right alongside your circulatory system, and without it, you would be dead within 24 hours. This critical and often overlooked aspect of anatomy is the lymphatic system. The lymphatic system consists of a complex network of lymphatic vessels, glands or nodes, and organs, such as the spleen and thymus, extending throughout the body. To understand its importance, we simply need to examine its three main functions. First, it returns excess body fluid back into the bloodstream. Blood loses a certain volume of fluid because capillaries are leaky. Tiny pores allow nutrients and oxygen to exit the capillaries and reach the cells that need them. However, due to the blood pressure, fluid plasma also leaks out of the capillaries. About 20 liters of fluid leaks out of the capillaries every day. This fluid mainly contains water, nutrients, gases, ions, and proteins. Of that amount, 17 liters will be reabsorbed into the venous end of the capillaries, but 3 liters will not be reabsorbed by the blood vessels. That's where the lymphatic system comes into play. Lymphatic vessels zigzag around the capillaries, collecting the excess fluid and eventually redepositing it into the circulatory system. The lymphatic vessels merge into larger lymphatic trunks and then reach a lymphatic duct, where the excess fluid, now called lymph, can empty back into a vein. One of the major ducts in the body is the thoracic duct, located around your chest. It's important for this excess fluid to return to the bloodstream for several reasons. First, it prevents the fluid from causing cells to swell or become damaged. Second, if fluid doesn't re-enter the circulatory system at the same rate that it leaves, the blood could become thicker, affecting how well the circulatory system transports oxygen and nutrients. Lastly, the fluid contains waste molecules and toxins that the body needs to eliminate. Now, you might be wondering how the lymph moves from the vessels to the duct if there is no heart to pump the lymph around. Well, something is pushing it, just not your heart. Every time you move your body, the lymph within the vessels moves. This is yet another reason why you should exercise. It speeds up the rate at which lymph drains back into your blood, ultimately improving your blood circulation. Better blood circulation means all the cells in your body receive more essential oxygen and nutrients. Second, the lymphatic system assists the immune system in catching any invading bacteria. Bacteria can quietly hide among your cells and enter your body through the large pores of the lymphatic vessels. The result of this infiltration could be serious illness. However, along the lymphatic vessels are immune checkpoints called lymph nodes. The lymph nodes have immune cells such as macrophages, dendritic cells, and lymphocytes such as B cells and T cells patrolling the node for any intruders. When they encounter a bacteria, immune cells such as dendritic cells neutralize the threat while also clearing any other toxins in the lymph. The lymph organs, including the spleen and thymus, are key sites where these immune cells mature into cells that are capable of fighting infections. When you have a throat infection, bacteria and white blood cells accumulate in the lymph nodes of your throat, causing them to swell. These swollen glands can block your throat, making it difficult or even painful to swallow. This is why doctors often check for swollen throat lymph nodes to determine whether you have an infection. Lastly, the lymphatic system plays a role in absorbing digested fats. Digested fats are covered in proteins and salts that help them dissolve in water. However, this also makes blobs of fat too large to enter the capillaries. Instead, the fats enter through the large lymphatic vessels. The fat blobs are then transferred to the veins of the thoracic duct. Without the lymphatic system, your blood would become thicker, your immune system would suffer, and you wouldn't be able to meet your nutritional needs, not to mention that you would likely be dead within a day. The good news is that maintaining a healthy lymphatic system is fairly simple. Just follow your doctor's orders, get a nourishing amount of sleep, exercise regularly, and eat nutritious food. You're probably familiar with
I like all the graphics. It explains it better than I could, so I went with a video for the lymphatic system. The cardiovascular disorders, for short, CVD. It is the leading cause of early death in Western countries. It includes the disorders of the blood vessels. Hypertension or high blood pressure, atherosclerosis often lead to a stroke, heart attack, or an aneurysm. So hypertension is a systolic pressure of 140 or greater, or a diastolic pressure of 90 or greater. It's called a silent killer because there are very few symptoms until it actually causes kidney failure, a heart attack, or a stroke. The most commonly treated with diuretics, which increase the production of urine. It reduces fluid buildup throughout the arteries and veins, which slows down blood flow and, in turn, reduces blood pressure. Atherosclerosis, a buildup of atherosclerotic plaque in the walls or blood vessels. Plaques narrow down blood vessel diameter, which decreases blood supply to the tissues, can cause clots to form in the roughened walls of arteries. A thrombus is a clot that is stationary. An embolus is a clot that detaches and moves throughout the bloodstream to different areas of the body. And a thromboembolism is an embolus that has become lodged in a blood vessel. So this is just an example of plaque. So there's your coronary arteries. We blow one up. This little blob of fat, cholesterol, and crystals is called a plaque, and you can see it literally blocks the artery, so blood won't be able to flow through there efficiently. A stroke, a cerebrovascular accident, or event, or CVA, occurs when a cranial artery is blocked or bursts. Part of the brain dies due to lack of oxygen, and symptoms may include numbness of hands or face, difficulty speaking, and an inability to see in one eye. And I put the little graphic there. If you don't know the stroke symptoms, the signs of a stroke, FAST is the acronym. So is their face drooping? Is their arm abnormally weak for some reason? Are they having speech difficulties? Then it is time to call 911. A myocardial infarction, which is a fancy name for a heart attack. Part of the heart dies due to lack of oxygen because of that plaque buildup in the coronary arteries. Blood doesn't flow properly. Oxygen does not get to where it needs to go. It can begin with angina pectoris, which is pain in the chest from a partially blocked coronary artery. It can be treated with drugs that dilate blood vessels. And a heart attack symptoms are actually a little bit different in men and women. Women have basically the added symptom of feeling nauseous, lightheaded, or unusually tired. An aneurysm is a ballooning of a blood vessel, most often in the abdominal aorta or blood vessels in the brain. Atherosclerosis and hypertension can weaken a vessel and cause ballooning. If a major artery ruptures, death can result. Medical treatment for a thromboembolism is a fancy word called tissue plasminogen activator, or TPA for short. It is a biotechnology drug, meaning we didn't get it from some other organism or some natural remedy. Scientists actually got together and made this up in a lab somewhere. It converts plasminogen, which is a normal protein that we have in our blood, into plasmin, which is an enzyme that dissolves blood clots. The prevention of a thromboembolism is actually aspirin. It lowers the probability of clot formation and clot formation and heart attacks, among other health benefits, when taken at very low doses. Treating clogged arteries. People can have, if it's bad enough, they'll have an operation. A vein from the leg is taken, and then used to bypass a clogged artery so that your heart will get the oxygen that it needs. Gene therapy. We can now inject a gene for vascular endothelial growth factor will induce the growth of new vessels, and new vessels that aren't clogged by plaque will carry oxygen properly. If they get the gene therapy, there's usually no need for bypass surgery. Or an angioplasty. A tube is inserted into the clogged artery to insert a stent, which is the mesh cylinder that will hold it open. The balloon gets pulled out, the stent stays. And stents are usually coated in drugs to dissolve the blockages. You can see the GIF there. That's the stent, the wiring, the crisscross wiring. They blow up the balloon, take the balloon out to leave the stent, and the artery is now open for blood flow. Heart failure is when the heart no longer pumps properly. There are various treatments, the wrapping of the heart to prevent enlargement. FVICD will correct an irregular rhythm. People can get a heart transplant if it's really that bad. The injection of stem cells to repair a damaged heart. We have left ventricular assist devices, which are battery-powered pumps to assist the heart if your left ventricle isn't pumping through the aorta or hard enough through the aorta to make it pump through the rest of your body. Or a total artificial heart, which is a temporary solution.